This is a software based app test introduction. Here, for implementation of this, for recording of this Rorschach test, uh, one has to select from this total app utility, and here I have selected this and uh, Rorschach test. Here we can see how to operate the test. First, user has to select the attempt response. It means कि test responses will be recorded by the app. One has to upload the images one by one up to the 10 images. And now we can see the image number 1. Then uh, using some paint app or other app, one can mark the responses and record the responses at the this 4 box as shown from some previous record. 1 2 3 4 test numbers, 1 2 3 4 marking numbers and indication by the testee. Then here we can also see ki what are the known recommended bloat areas. One is to avoid some bloating areas. uh, uh, see, After the test completion, we will see some examples of the this course which has been already prepared using the scoring guidelines. And at the end we will see the this is something about Rorschach ink blot test, and it is one of the most important and frequently used tests in the clinical setups. The test permits a clinician to formulate physiological diagnosis, understand and the personality, and provide clues that are useful in psychotherapies. And there are a number of quantitative and qualitative indicators suggesting the existing of psychopathology in a patient. The test was discovered by Herman Rorschach, and he came if he finally came up with 10 set of 10 ink plates. Rorschach ink plates are prepared by throwing some inks on white sheet and folding it in the middle. In 5 plates only black ink is used, and in the remaining 5 plates uh, chromatic colors have been added. As we can see in the images, this test is called the projection test. The Here the patient is shown the pictures, and the patient, he or she is asked to write whatever they can see in the picture. In the test, the examiner has to note some specific things about the responses, like location and orientation of the card. When examiner presents card to the subject can turn the card uh, top bottom left right. Examiner has to record the same, and uh, the research examiner is also required to record all card position and the responses. During the test, the observer or third person or any family member in the room during test administrations are not allowed. After discussing the basic methods of basic procedures, the subject has to be asked, tell me what you can see in the card. There is no detailed instructions then how to interpret the card. One can see ki some animal, bird, plants, and anything they are seeing. Uh, then as soon as the card is handed over, the examiner has to note the time at the time of handing over, and then the time elapse between the response start. After the complete response, they have to note down the uh, uh, card response close. The two times are called reaction time and the response time. The responses by the subject can be marked by some colored pencils, or one, as 1, 2, 3, 4, and uh, subject has to mark on the card what are the number of responses. After the responses are complete, next card is presented after uh, 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 after it some break time between the two presentation of the card. Next, continue to present the card and record responses till last response on the card 10. This phase of obtaining responses to card 1 to 10 is called response phase or free association phase. Sometimes the subject may try to reject the card. A subject may keep on producing too many responses on a card. You may obtain 10 or more responses on a card, but if 4 responses are enough for one card. After completing the response, all the cards are collected and the examiner has to make an inquiry phase. Inquiry phase means if an examiner thinks ki he wants to ask some question about the response, then he can ask where in the ink blot you see the perceived object, why the blot area looks like the perceived object. Uh, Rorschach images are mostly symmetrical in nature. Some subjects produce responses in pairs, incorporating both sides of the blot. In such case, one may trace both sides of the blot or trace any literal side. After the response is complete, the examiner has to score all the cards. For scoring is a complex process including the variables of blot area, object attributes, key and object category, most frequent responses. As per the guidelines, the image has been divided into some blot areas as total blot area, common blot area, uncommon blot area. Guidelines to resolve part 2 blot. uh, with a simple practice, the student may learn how to score the research charge cards. Doing and scoring as many responses and as many examples, one will learn how to find out the particular scoring codes. The examiner or the learner must follow the guidelines to find out the uh, codes for the responses. Finding this is not difficult, but it requires a bit practice. Sometimes one is not able to decide what code is to the given due to limitations of the guidelines, where they have given some specific codes for responses, then one have to use their own judgment regarding that particular coding. And examiner should not panic if commit any mistake in labeling a bloat area. And one will continue to learn from every protocol. The most frequent responses uh, are the hints from the Rorschach test writers. Here we can see the responses from one pre-recorded set. These are the marked images, and these are the responses with inquiries. Every social charge is correspond to one or the other psychological attribute or symptoms. Indices may have multiple interpretive significance. Indices rarely point out to any psychological syndrome. It is just a clustering of indices that can suggest that this can be the problem of any disorder. Then, after the scoring, that indices are plotted, and percentage indices are find out to find any indication. Then a neat report has to be prepared. Instead of adopting the report format, one may also generate a report in paragraph interpreting various values, beginning, or you find format, whichever format one might find easier. The diagnosis generated through psychological test results is only suggestive of a diagnosis. It is not confirmatory of any diagnosis. So one should not interpret that this is certainly there. It is just an suggestive along with other tests of the patients and the patient history of patient's test. Who was Herman Rorschach? He was born in 1884 and 1922, and he had a very short life. Uh, Rorschach has the